Hi, this is Yüksel. Today I want to discuss with you TALAPRO-3 Trial, which is presented by Niraj Agarwal yesterday. Actually, TALAPRO-3 Trial compare Talazoparib plus Enzalutamide and ADT versus Enzalutamide plus ADT in patients with metastatic hormone-sensitive diseases with homolog repair gen defect, which means include patients with BRCA, BRCA2 mutation, and all other HRR defect. And trial randomized around 600 patients into both arms, and the primary endpoint of this trial was radiologic progression-free survival, and which shows us adding Talazoparib, the standard treatment of ADT plus Enzalutamide, shows clear radiologic progression-free survival benefit, which is around 50% reduction in risk of progression or death. And when we look at the subgroup of the patient, of course, the magnitude of the benefit is much higher in patients with BRCA mutation, but is still consistent in non-BRCA group 2. But the toxicity is one of the main concern for us. The anemia and blood transfusion need in significant amount of patients, so we need close follow-up to our patients. What brings this trial to us? Actually, still OS data is immature, and we don't have the final OS data for this trial, but which shows us the molecular test in prostate cancer is not optional anymore. We need to do molecular test for every metastatic patient with prostate cancer to be able to decide which treatment for the which patients. So for now, this trial, TALAPRO-3, bring PARP inhibitor on early stage of diseases, and after the amplitude trials, now we have another evidence of the benefit of adding PARP inhibitor to ADT plus PARP in early setting of the diseases. I want to discuss with you the ENZAMET Decipher result. Actually, for a long time, we intensify treatment for patients with metastatic castration-sensitive diseases. But today, question is not to intensify or not. Which patients need intensification and which patients need less treatment? This is one of the main questions for us for a long time. And we all know the ENZAMET trial, which is compare enzalutamide plus ADT with ADT, and also docetaxel use alongside the treatment is permitted. And the result presented by Chris Sweeney in this Congress at ASCO Annual 2026, and which shows us the primary hypothesis of the trial was Decipher score more than 0.85 will benefit adding docetaxel to standard treatments. And it's proved in this man with castration-sensitive diseases with Decipher score of above 0.85 get more benefit from the docetaxel. So now we have more data about when to intensify our treatment in patients with metastatic castration-sensitive diseases. So the question became more clear. We need intensification in some patients, not only about the risk of the high volume, high-risk patients, but according to molecular classifying the diseases will bring us better and precise answer to which patient need treatment intensification.